Hello and welcome to North Stars University, an educational series. Today's topic is going to be medication management, a very important topic. My name is Ignacio, owner of North Star Senior Advisors and also licensed practical nurse. So let's dive into it. Medications, as you know, can play a critical role for our lives, especially in the seniors, when it comes to managing different disease processes, keeping things in line, optimizing performance, if you would, with any disease in place. So it's very important to make sure that medications are taken, number one, properly, the doses are taken properly, and the proper precautions are taken depending on the medication itself. But I wanted to share some typical mistakes, if you would. So number one is taking your medications. Making sure that you're taking the medications as prescribed is going to be important at the time that you're supposed to take them. And then also keep in mind some medications, for example, for high blood pressure, or for example, insulin for diabetes. There's certain things you may have to do prior to taking that medication, such as checking your blood pressure, checking your glucose level. That's going to be important to determine if the medication should be taken and how much of it, and things like that, as prescribed by the physician. So that's number one. The other thing that's also very important, actually extremely common for the elderly and the seniors as we continue to age, especially when you're in and out of the hospitals and nursing homes, is that prescriptions and medications may and most likely will change. There's a possibility they may discontinue a specific medication and or modify the doses on the medications you may be on, given the potential, risk factors or whatever may be going on at that point in time with your condition and that disease process and that condition. The physician may choose to change the medications and change the prescription. So what happens typically is individuals will have their medications at home, go to the hospital, come back, and now have a completely different set of medications, and they don't know what they're supposed to be taking and how much. So that's what's called medication reconcile. You want to reconcile your medications. Reconciling your medications is extremely important. And traditionally, it's something you want to have an expert or registered nurse or a nurse come to the home and making sure that, again, if you're discharged from the hospital or a nursing home and you're now back home, to make sure that your medications are reconciled properly and you're taking the most accurate medication and prescription as ordered by the physician. Failure to do this can lead to potential issues, complications, side effects, which can then take you right back to the hospital, and nobody wants to do that, of course. So for that reason, it is very important to pay attention to the proper dosing, the proper medication, using the latest prescriptions from your physician. And folks, if you're watching this, or you're concerned about your parents or your loved one, you're going to want to make sure that this is focused on and it gets a special level of attention. So check with your loved one, check with their physician, making sure that everything is accurate, that they're currently taking. That's going to be extremely important. So again, medication management is the topic of this video, a very, very important topic, something that we all need to pay attention to as we continue to age, especially for our seniors. And it's something that can be, again, extremely beneficial, or it can be detrimental when it's not done properly. Hopefully this helps. If you have any questions, let us know.